Cases of COVID-19 continue to climb in both Minnesota and Wisconsin. Here are the latest numbers. Minnesota has more than 1,600 confirmed cases of the virus. 70 people have died. In Wisconsin, more than 3,300 people are sick. 144 people there have died. We want you to be as informed as possible about COVID-19, and that's why we are asking for your questions. Tonight, I FaceTimed with Helen, the president of Regina Hospital in Hastings and River Falls Area Hospital in Wisconsin, and she shared her thoughts on the days ahead. We know that you work in both Minnesota and Wisconsin, but do you see a difference between states really when it comes to fighting this virus?
We don't see a big difference in western Wisconsin compared to the Twin Cities and Minnesota. I think mainly because we've most of our everything happens for folks in western Wisconsin in the Twin Cities, where they receive a lot of their tertiary health care. But certainly Madison and over towards Milwaukee are having a few more issues than we are in the Twin Cities today.
And we do hear that message from Governor Tim Walz almost on a daily basis, talking about how Minnesotans seem to be doing a good job social distancing. But how is that impact felt in your hospitals?
Well, it's made a tremendous difference. I can't even say a month ago, when we started to get ramped up for all of the surge we were hearing about and things, expecting it in a couple of weeks. Here we are a month later, and we certainly are seeing hospitalized patients and patients in our ICUs, but not to the extent that we would have if everyone hadn't been doing such a great job.
If you could kind of set the scene at your hospitals in Hastings and River Falls and your PPE supply, how is that at this point? Do you feel like you are prepared for the peak?
I think we're all concerned about PPE, and we'd be remiss to say if we thought we had absolutely everything that we need, and to keep. We're doing the very best we can by reusing and reducing the use of important masks and gowns and gloves as much as possible. But our nurses and physicians have to be kept safe, and so we're trying to do our very best to do that in a very difficult situation. Our hospitals are ready, for as ready as we can be, given the modeling we've been doing and the way the curve has been behaving. We think we've got the right numbers of beds, and Alina Health is on a full court press, getting ready for almost 100% more intensive care beds than we had before COVID. So we are all working diligently to try to get as ready as possible.
I wanted to ask you some viewer questions now, Helen. This is from Kimberly. She says, I've been making handmade masks to donate to my local hospital. I'd like to know if they're actually using them and how they're using them.
Well, I wear a handmade mask every day that I'm in the hospital, and so do all of our, at Alina Health, all of our non-patient facing staff are using the handmade masks. I have to admit, a month ago when we started to think about this, we weren't sure how we would use handmade masks, but today they've become a really important part of our uniform. For those of us who aren't in front of patients and wearing factory-grade masks, the handmade mask is helping us for source control and making sure that whatever is mine is staying mine, and whatever is my colleagues is staying theirs. So we're grateful for all the donations that we've received.
And Mary kind of asks on that similar point, do cloth masks need to be washed after every use? She's wondering.
We have a policy at Alina. We wash our masks at the end of each shift, have a new mask for the next day that's clean. So we ask our employees to make sure that they're always wearing a clean mask. They're protecting you, they're protecting others from you, those masks, so that just to make sure that whatever you have on the inside of your mask is getting cleaned at the end of each time that you're wearing it for the day.
Sarah is wondering about asymptomatic people. How long do they carry the virus?
Well, I'm reading then, and like everyone, we're reading that it may be up to 2 weeks that you're asymptomatic, that you might have the virus. It's another good reason to wear those homemade masks. That's source control. In case I do have the virus and don't know it, I'm able to keep my virus to myself, so to speak, when we wear a mask. So I think it's getting important part of how we're trying to keep each other safe, along with the 6 feet distancing and making sure we're not spending too much time around other people.
This is a good one. I think Jacqueline is wondering about here, but she wants to know, how do you know if your symptoms are serious enough to go to the hospital? Because I think there was this trigger weeks ago that everybody thought they had to go in immediately.
Well, now we have an incredible thing that's happened in Minnesota with virtual visits. And in January, I think our system did 100 virtual visits, and we did about 3,000 the other day. So we're all getting really good about making sure that patients can be seen when they need to through virtual visits. And that's the best way to access care at all the healthcare systems and clinics right now, is to, if you're feeling like you've got the virus, if you're feeling like you're getting worse, to go to your provider's website and sign up for a virtual visit, and within a few minutes we'll have an answer for you, either by an online assessment or through an appointment that can be made with a virtual visit to hook you up with a provider.
And I imagine the breathing problems would be the most serious.
Yeah. You know, when you're feeling like you're short of breath, your fever is not being controlled well, and it's getting harder to breathe, that's the ticket to get into that emergency room. I'd be lying if I said we weren't anxious. I think our staff have every right to be worried and concerned when you see what's happening in other states, and how patients can come in a surge that is very difficult to handle. We're hopeful that our flattening the curve here in Minnesota will allow us to be able to cope with what's happening.
Do you have any questions about COVID-19? Let us find the answers. You can send your questions to tips@wcco.com.